Good afternoon, everybody. My name is Bev Lang, and I'm the Executive Officer with Elder Abuse Action Australia. I'd like to acknowledge the traditional owners of country throughout Australia on which we're meeting today and recognise their continuing connection to land, waters, and culture. I particularly pay my respects to the elders past and present of the Darkinjung land north of Sydney, which is where I'm meeting from today. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people joining today's gathering. I'd also like to mention that EAAA is committed to ensuring equitable and inclusive responses to the abuse and mistreatment of people with diverse characteristics and life experiences. Welcome to today's Lunch and Learn session. These sessions give our members the opportunity to showcase their work and share this learned knowledge and experience with a growing audience of people from the sector and indeed communities around Australia. Before I introduce Katrina, I just want to go through a couple of housekeeping comments. If you'd like to ask any questions or make comments, please use the chat function at the bottom of your screens. And please be respectful in your interactions with each other and, of course, our speaker. As we have, if your question isn't answered during this session, and we'll endeavour to get to a lot of them, we'll endeavour to compile all unanswered questions and share the responses with everyone who registered. CC Captions is available for this Lunch and Learn, and please take this opportunity now to select the function on the bottom of your screen if you need it. This session will be recorded and will be available for you to share with colleagues or indeed watch back again, but a little more on that later in this presentation. Thank you for all the questions you've submitted. There were quite the list that Katrina's had to review and where possible include in her presentation. But we will have quite a period of Q&A time this afternoon, so please be ready for submitting your questions. There'll be a little survey that bobs up towards the end of this session, so please share your feedback. It's always helpful for us as we continue to improve the presentation, how we do Lunch and Learns, but also the topics that we can cover. We're very pleased to welcome Katrina Ryan from Aged Care Justice to present our first Lunch and Learn session for 2026. Katrina is the Legal Education Lead at Aged Care Justice, where she develops legal education materials on aged care law, rights and accountability for the public and the legal profession. Aged Care Justice is a registered charity supporting Australians living in residential aged care or receiving home care. Their work focuses on access to legal services, education about aged care rights and advocacy for reform across the sector. In today's presentation, Accountability in Aged Care, Rights, Responsibilities and Remedies, Katrina will explain the new duty imposed on registered providers and individuals nominated as responsible persons and how this duty operates in practice. It will also examine how breaches of the duty give rise to regulatory action or civil liability and the legal pathways available to consumers seeking support, redress or compensation. Key discussion points include understanding the statutory duty of care, due diligence and leadership accountability, consumer impact and potential remedies, and why this matters. Aged Care Justice have been an organisation member with EAAA since 2022, and we're very pleased to begin our program this year with their presentation. Please join me in welcoming Katrina. Thanks, Katrina.
Thanks, Bev. That was a great introduction. I think you covered everything on my end, introducing me and the organisation. But just to follow on from Bev, yes, ACJ or Aged Care Justice was established in 2020. So it was quite, we've been around for a little bit of time now. We used to say that, we were quite a young organisation, but we're becoming more and more established, and just wanted to let everyone know that our model is providing legal services through access to specialist aged care lawyers on our panel, which is Australia-wide. And what we want to do is to move into a model where we can provide direct legal services and become an accredited community legal centre, hopefully the first aged care community legal centre. So that's what we're working towards, because we want to be able to respond to the community need in a more expedited way. There are wonderful services out there, such as advocacy and seniors' rights, helping people in the community, but we feel like a dedicated service for people who are receiving care would be crucial, because the legal issues are so complex. But that's just a little bit of an intro on ACJ. So this presentation will be focusing on accountability in aged care, but primarily on the new statutory duty for providers and responsible persons. If we can just go to the next slide. Probably the next one, actually, because we've talked about ACJ. Yes, so as you're all aware, you're probably all aware that New Aged Care Act commenced in November 2025, and with that, it imposed many new obligations on providers. The obligations that we're talking about today is the statutory duty, so it's written into the Act for providers and for responsible persons to prevent harm in the delivery of care. The reason why we've focused on those duties is because they're the most significant. They attract the most significant penalties. And it's something that the Royal Commission recommended. So that's why we're focusing on that today. And the key discussion points will be understanding what is the statutory duty or obligation for providers, understanding what it is for responsible persons, the due diligence and leadership accountability, how senior leaders must demonstrate active oversight of compliance, safety and risk management, which is new to this Act. And again, it was a Royal Commission recommendation that more senior oversight needs to happen to improve quality care. When the financial penalties and compensation do apply, because they don't always apply, and the complaints process in general, which is under the Act as well. So first we'll start with the registered provider's duty to prevent harm. So providers have a duty under the Act to do what is reasonably practicable, not to cause adverse effects on the health and safety of the person receiving care in the delivery of funded aged care services. So it's quite specific. It has to be a registered provider, and they have to be delivering funded aged care services for this duty to apply. And then what is reasonably practicable, they have put a definition into the Act. And it's quite a detailed definition. So the likelihood, they have a duty in relation to preventing the likelihood of the adverse effect concerned, the likely degree of harm, what the person concerned knows or ought to reasonably know about ways of preventing that adverse effect, the availability and suitability of ways to prevent the adverse effect, and the rights of individuals under the Statement of Rights. Now, sorry, James, if you just go back one, that's fine. So the reference to what is reasonably practicable imposes an objective standard on providers to consider a range of matters, like it has in the definition. So this is necessary because even in the delivery of best practice, it may be difficult to prevent harm to an individual, and that's why it's based on that objective standard. And then in determining the Statement of Rights, in determining what is reasonably practical, they must refer to the Statement of Rights and consider, I think we used to call this dignity of risk, we could still call this dignity of risk, the individual's, decision not to accept recommendations about their care. And again, just further on that, it is assessed on a case-by-case basis. So the considerations might include the specific care needs, the relevant regulations imposed on the provider, so the wider industry standards, the health standards, and other instruments that guide that, the health conditions, the aged care rules, quality standards, and then identifying any foreseen risks, documenting those mitigation strategies with input from appropriate experts. So that's really been ramped up in the new Act, that sort of anticipatory duty. Now, to be eligible for financial penalties and compensation, there is quite a high bar set, and this is just for provider duty. Now, financial penalties and compensation apply under the Act. However, they require all of the below criteria to be met under the Act. So first, it has to be determined that the provider even has a duty. So are they a registered provider? Are they providing government-funded aged care services? So do they have that duty to not cause adverse effects to the aged care recipients when delivering those services? It has to be determined that the provider has not complied with that duty of care in delivering the funded services. So this includes showing that the delivery of services was not reasonably practicable in the circumstances, and the provider did not have a reasonable excuse for not complying. Now, reasonable excuse could be for not complying may include exercise of personal choice, as we were saying before, the wishes of the resident regarding care, and taking into account the statement of rights, so the risks and the dignity of risk. So they could be defenses for the provider, if you like. And the number 3 is the conduct by the provider has to amount to a serious failure to comply with their duty. And then serious failure is set out. So to be a serious failure, the Act requires that both A and B must be met in the Act, which is the conduct of the provider expose the individual to the risk of death or serious injury or illness, and the conduct involves a significant failure or is part of a systemic pattern of conduct. So it can either be one or the other. So it could be an event that was so significant, it was a significant failure, or it might not reach that threshold of significant, however, it's a systematic pattern of conduct. And then they've gone through and actually put in definitions, or their own definitions, for the purposes of that duty into the Act. So the term serious injury or illness, according to the Act, is of an individual means an injury or illness requiring the individual to have immediate treatment. So again, it's quite complex and it's quite a high bar to even access compensation or to find a breach, which would lead to a financial penalty. So they've put a prescribed list in of the types of injuries. So immediate treatment for amputation of any part of the individual's body, serious head injury, serious eye injury, serious burn, the separation of the individual's skin from underlying tissue such as degloving or scalping, spinal injury, the loss of a bodily function, serious lacerations or a serious wound, and pressure injury. And I know a lot of you probably were a part of the consultations and the different permutations of the Act as it came into the Aged Care Act 2024. And when this was first listed, they were quite serious injuries, but they have now been extended under the aged care rules. So under B, it is or medical treatment within 48 hours of exposure to a substance and includes any other injury or illness prescribed by the Aged Care Rules 2025. So they do add dehydration and malnutrition because they are 2 major or highly reported illnesses or conditions that people experience, but they weren't in this list. So now they are, and they're a part of the duty. Now they go on to define significant failure and systematic pattern of conduct within the Act. So you have to meet all of these definitions, not just 1, 2, and 3, A and B, but then you have to go on and you have to meet those definitions. So the significant failure, the Act defines a significant failure as conduct which is a significant departure from conduct expected from a provider having regard to requirements in the Act, or the systematic pattern of conduct. The term systematic pattern of conduct is also defined in the Act, includes and it looks at any previous contraventions of the Act, the number of people impacted, the period of time, and how the provider has responded to those contraventions. So they could be lower level than a significant failure, but if they're repeated, then it might meet that systematic pattern of conduct to be a serious failure. And that, yes, Kerry's just put a comment saying the serious is too subjective. it is. It's very, they've purposely defined it so that they can apply the penalties once you meet these definitions. So I think they've tried to keep it narrow for the sake of having a process, a statutory process for trying to determine the breach. But yeah, I mean, again, this only came in, the act commenced in 2025, November 2025, so it's only a few months ago, and it'll be interesting to see how it's tested in court. So the financial penalties, if it has been determined by a relevant court, it has to be a relevant court, that the provider has breached the statutory duty, provides for financial penalties and possible compensation. Now, the financial penalties for the provider are the most significant. So 150 penalty units for individuals and 1,000 units for providers that are not individuals. So business entities, that could be partnerships. So the only way to sort of define that is to say for providers that are not individuals. Now, when it amounts to a serious failure that results in death or serious injury or illness, it's 500 penalty units and 4,800 penalty units. Now, the Crimes Act sets out what that penalty unit is worth, and it does change. But right now it's $350 per unit. So that is, the highest would be 1.68 million financial penalty for a provider that the serious failure has led to death or serious injury or illness. Then with the compensation, so the aged care recipient or the commissioner can apply to the court. So once the breach has been found, you can then apply for compensation. Either the aged care recipient can or the commissioner can. They can ask the commissioner to do so on their behalf. Once it has been determined that the act resulted, or the conduct resulted in serious injury or illness. So that is the only pathway if it results in serious injury or illness. It's only pathway to access compensation. Now, when you bring an application to the court to determine a breach, it's either the commissioner, but the aged care recipient or their family can as well. However, the onus is on the person making the allegation to show that on the balance of probabilities there has been a breach, and they have to follow all of those points just listed and meet all of those definitions. So the summary of the above, just to kind of go over it. So on application for a civil penalty and or compensation to the court, the court must be satisfied that the provider provided funded aged care services, so meaning the duty applied to them because they're a registered provider providing aged care services. And in the delivery of those services, they did not comply with reasonable standards. The conduct resulted in the risk of death or significant injury or illness, and the conduct was a significant departure from standards of care. So this isn't, all three must be met. Or the provider has a history of serious repeated contraventions of the Act. And that's the only way that you'll be able to find a breach and then access compensation or have financial penalties imposed by the commissioner. So the other consequences, you do have the complaint pathways. If the court determines that there has been no breach, the commissioner can pursue other remedies. And there are other regulatory actions that they can take, like unenforceable undertakings. They can ban, they can suspend a provider's registration. And then there are also psychological harm is included. Or psychological harm. Actually, that's a good question because they have a very distinct list. But psychological harm might be under common law. I'll have a think about that one. But then, so the providers have obligations under the Act in addition to the statutory duties. They have wider obligations, and that's why if the court does not determine there's been a breach, they will look at others. And then remedies under general law, and that's where the psychological harm might be, where your avenue, because there are obviously general law of negligence, like a general duty of care for personal injury resulting from breach of duty of care. Personal injury includes psychological harm. There also might be other duties imposed by laws of the Commonwealth, so it might be health, and then the state or territory. So, that health is guided by state and territories, not the federal law. So we've put a little bit of an example here of a provider breach of duty and the kinds of considerations that should be made. So the aged care resident has cognitive decline, has a history of falls and relies on a pushchair and personal assistance to move around the facility. The resident falls in their room trying to get to the bathroom. The resident falls on the hard bathroom floor, sustaining a head injury requiring hospitalization, resulting in a brain bleed or hematoma and needs an operation. The resident's care notes state the resident has had previous falls as they forget that they cannot walk unassisted. The resident has sustained a significant injury as defined in the Act. Also, because the injury needs to be defined in the Act as immediate treatment, I think that psychological harm would probably fall outside of it because of the immediate treatment requirement. Maybe not though. Maybe if someone had an episode, psychotic episode, I don't know. So again, we haven't had this tested in court. So has the provider breached their statutory duty? Considerations. The resident has a known history of falls attempting to go to the bathroom. The court will consider the conduct of the provider. Was it a significant departure from the care standards related to the specific facts and related to the care of that individual? And has the provider assessed the risks of falling near a bathroom? And if so, what were the mitigation strategies considered, such as handrails as recommended by professionals? And then if so, did the resident refuse the mitigation strategies, which can be a defense? Responsible person. So the responsible person's duty to prevent harm. These two duties are related because the responsible persons has a duty to ensure the provider has the resources to uphold their duty. So they're related duties, and the responsible persons is new. We can see that over time that certain cases have proceeded to court where responsible persons have been accused of certain action or lack of action, and but now there's a statutory duty there that gives people a bit more of an avenue if they believe that there has been a significant failure in supporting the providers. So the Act imposes a duty on directors, board members, and executives actively involving and they have to be actively involved in managing providers to ensure providers have process and skills to prevent harm in the delivery of the services. So the responsible persons are and so there are a range of responsible persons, but only certain responsible persons have this duty to prevent harm. So they can include directors, board members, executives, and it's included in the definition of the Act, and they are required to be named in the provider registration documents. So that's something that you can find. And again, responsible persons can include workers with other responsibilities, but only the directors and the executives have a duty to ensure the provider are adequately supported to uphold their duty to prevent harm. So then the due diligence. So the Act imposes a duty on certain persons to exercise due diligence. So it's kind of the due diligence duty to ensure providers comply with their duty not to cause adverse effects. And we just go to the next slide. So they have defined due diligence. And sorry, these slides are a little bit out of whack because we had to, at the last minute, convert them to a PowerPoint, but we'll make sure they're all, I have a PDF version, which is nice that I can share with everyone after this. So the Act defines due diligence, and it includes taking reasonable steps. So again, reasonable, is judged on an objective standard. So to acquire and maintain knowledge of requirements applying to providers under the Act, to gain an understanding of the nature of the funded aged care services the provider delivers and the potential adverse effects, to ensure that the provider has available for use appropriate resources, processes to manage adverse effects to the health and safety of the residents and the recipients, to ensure the provider has appropriate processes for receiving and considering information regarding incidents and risks. So they can't say, well, we didn't know. Well, you didn't have a process to know. To ensure that the provider has and implements processes for complying with any duty or requirement under the Act. So this is new to the aged care landscape, this type of responsibility. And again, it was a recommendation by the Royal Commission. So they have applied this in the new Act. So if the court determines that a responsible person has breached their duty to take reasonable steps, and where are we? And just on that due diligence, it kind of, to put it into real terms, they have to be actively involved in mitigating that risk. So it does bring them into the activity of the provider a little bit more than it did before. And the reason why the Royal Commission recommended this was not just for accountability, but for improving the quality of care. The better systems you have, the more oversight you have, better governance, the better quality of care that you can deliver. It also requires oversight over the workplace culture, resource management, how the provider monitors breaches and deals with complaints, which is important. So the financial penalty provisions under the Act are enforceable by way of court proceedings, similar to the provider provisions issued by the Commissioner. But the Commissioner also has the powers to conduct a formal investigation into potential breaches. And similarly, they have to go through the same process as the provider provisions. So in order for a breach to be found, they have to meet all of this criteria, which again, it's a very high bar, it's very complex. They have to meet all of the definitions. Slightly different for responsible persons because so first it has to be determined that the responsible person has a duty so that they fall into that definition of the certain responsible persons, that they have that requisite authority. And then it has to be determined that they did not comply without reasonable excuse. And the reasonable excuse was similar to before with the wishes of the resident. If they were taking on the risk themselves and they had the decision-making capacity to do so. Reasonable excuse, the conduct of the responsible person amounts to a serious failure to comply with their duty. And then to amount to a serious failure, the Act requires both A and B must be met. So if we just go back to slide 7, or even 6, sorry. So again, they have to go through the serious failure provisions, and they have to meet both of these definitions. So the conduct of this time it's the responsible person, expose the individual to risk of death or serious injury, and the conduct involves either a significant failure, which is a significant departure from their usual conduct, or the conduct that you would expect of a responsible person, or is a part of a systematic pattern of conduct. And then just go to 7. Thanks, James. And then again, you need to fit this term. So the injury must fit this term, must be in this list or the list of the rules. And then, sorry, just go back to slide 15, I think it is. Yes. So again, it's quite onerous. It's it's only if it's a repeated breach or repeated contravention, I should say, or a significant failure, and it has to meet all of those terms in the list. And then if we go to slide 16, so the penalties for breach of the responsible person's duty are less than that of the provider. And they are 150 units or 500 units if death or serious injury has resulted. Responsible persons do have additional obligations under the Act. They could, and the Commissioner may ban a responsible person for not meeting their obligations. And again, the compensation works in the same way. The aged care recipient or the commissioner may apply to the court if it has been determined that there was a breach and that breach resulted in serious injury or illness, because that's your only pathway to compensation. And so, in summary, for the responsible persons, they have a duty to act carefully and responsibly, which is exercising due diligence to ensure the provider complies with their duties, to take all reasonably practicable steps to prevent harm. So it's another layer of accountability, but again, we don't know how this is going to be applied in practice. It's very new. We don't know how it's going to be, it hasn't been tested by the courts. And then you have the complaint process. So the complaint process involves, and I'm sure a lot of you are aware, you raise the complaint with the provider, seek resolution. The complaint process is useful in that it can provide you documentation, it can provide you with information from the facility, it might provide you access to more information and care plans, even though they have a right to access that anyway, the aged care recipient. But it in the context of a complaint and a substandard care, that then a complaint can assist with that. If unresolved, lodge a complaint with the aged care regulator after you've raised it with the provider and they haven't, and you're dissatisfied with their response. Then if you're dissatisfied with the outcome, request a review from the Aged Care Quality and Safety Commission of their prior complaint response. Then if concerns remain, you can escalate to the Commonwealth Ombudsman. Now, the Commonwealth Ombudsman, they can review how the regulator handled the complaint and they can make a determination on that, but they can't make a determination on the complaint itself. So they can't be the regulator. They can only make a determination that no, the complaint wasn't handled well. Aged Care Quality and Safety Commission need to go back and do more work and do more investigations. And then, of course, there's advocacy support through the Older Persons Advocacy Network, and they have their own state-based resources in each state and territory, which can be really helpful for quick resolutions, especially if the provider is willing to, willing to listen and willing to change. But of course, if you're not happy with how the communication is going, or you're still unsure of your rights, then legal advice might be required to navigate the issue and the legislation, because it is quite complex. Yeah. And then these are just a few of the questions that sorry, that you sent through, which were great. There were a lot of questions that were quite specific, like specific legal questions, and unfortunately, we can't provide responses to the specific questions only because we don't have all the facts of the situation, the case. But we are willing to take some questions, and this is what I was talking to Bev and James about earlier. We would like to take some questions back to our panel of lawyers, because they deal with these issues every day. They're specialist elder law lawyers, and we can present them to them and find some answers and circulate the answers. So I think that might be really helpful. So compliance required, but we put a few general questions in this slide. So compliance requirements as a small independent provider, it's a good question. All registered providers under the Act providing funded aged care services must comply with the obligations of the Aged Care Act. So if they're not providing government funded services, then they're not obliged under the Act to follow the duties. Enforceability when Aged Care Quality and Safety Commission take no action on a complaint. So that's what we just went through then, that you can escalate to the Commonwealth Ombudsman, or there might be remedies available outside of the Act, because everyone has the ability to look at consumer law, to look at common law, or other statutory instruments, but we're just looking at the Act right now, but there might be other pathways there. And then this was quite a general question, but has accountability for providers increased or decreased under the Act? So there are a range of new obligations for providers and individuals, so nominated executives and directors. And They relate to the registration provisions, delivery of care, training qualifications of care staff, and then also documentation, privacy, data keeping, financial and prudential obligations. So now there's a compensation pathway where there wasn't before, and it is within the Act. So you do have that statutory right to compensate, or a statutory pathway to compensation. The Act increased a lot of power of the regulator. The regulator has more powers to investigate and to apply more significant financial penalties. They can also vary, suspend and revoke registration of providers, which they did have before. There are shortcomings. We feel like there are shortcomings in the Act due to the statement of rights is not legally enforceable. It's more like an aspirational statement of rights. It's more principle based. And it's not, a lot of elder lawyers in Australia have, and we have also lobbied for obligations to be a part of the contract so that you're protected under consumer law. And then you don't have to default to the Act and the constraints within the Act. So, for instance, the statement of aged care rights could be written into your contract as obligations, and then you'll have more power to enforce them. So while there is greater accountability imposed on providers and more obligations, I would say, as opposed to accountability, but we have to see how these are actually enforced by the regulator, how the regulator uses their increased powers, and also if it is to proceed to court, or if breaches are found, or if the commissioner advances the allegation of a breach to the court and how the court responds. So that hasn't been tested yet. And how is the new law enforced? So the new law is enforced because through the application to funded aged care services. So it's only enforced on those services within the Act, and predominantly enforced by the regulator, as we've explained. And yeah, so, and again, Aged Care Justice, we are a legal referral service, and we provide legal education and also reform. And we've submitted a recent submission to the Senate Standing Committee on the aged care rules. And we did that jointly with Aged Care Reform Now, another grassroots organisation. But sorry for the font. We had to quickly convert it to PowerPoint because I had it in a PDF, but I will make sure that everyone gets the PDF version where you can click all the links. And just in the chat, I can also consider other options of concerns with service delivery. Yes, exactly. So you can consider your other avenues, the Human Rights Commission, and yeah, other state instruments as well. So again, you might the Crimes Act. It could be common law. So the service agreement for both private and stay-at-home funded somehow should be the same to deliver. Exactly. So home care and residential care should have really what is in the statement of rights should lend itself to obligations under the contract. And then you have more enforceable rights. You have personal rights, legal rights. Agreed. And then, sorry, I'm just looking at the questions. How does it work when you have some clients who pay privately as opposed to receive government funding? Do providers not have the same? No. So if the provider is providing services that are not government funded, then the Aged Care Act does not apply. Yeah. It is not being met due to we have encountered in many cases quality due to lack of staffing, and we receive complaints of that nature as well. Yes. And it's really difficult because we don't, I mean, as a legal organization that receives complaints from people receiving aged care services, you know, we're receiving the worst of it. I know that there's better reporting requirements, and with that comes an increase in reports of different conduct. Does that mean that the conduct is increasing, or does that mean that the reporting requirements are improving? So we just don't know how these changes are going to be realized in practice, and whether it's going to lead to improvement. But I think there are a lot of positive regulatory actions within the Act. It'll just be interesting to see how it actually plays out. That's right. So do you just want to clarify what I learned? You mean if the consumer, yes, if they're paying privately, and there's no government funded component to their aged care services, then the Act does not apply.
So Katrina, there's a couple of interesting questions that questions you've been going through.
Yes.
In an earlier question, someone asked, sorry, I'm just scrolling up here.
Yeah, go for it.
Who is the prosecuting body for breaches?
So the regulator. So the regulator has
okay.
they have investigative powers to investigate, and then they would have to bring an application to the court for the court to determine if there's been a breach. Yeah. And there are specific courts that deal with it. I'll get back to you on the specific courts. I believe it's the Federal Circuit Court, but I'll get back to you on that one. I'm trying to remember everything.
And look, I think there have been a couple of questions around psychological harm. And we'll come back. We'll talk to you about that offline, Katrina, and get some responses on that. Cecilia asks, would an infection suffered by a person or persons in a residential care unit and constant reinfection several times over a period of many months, perhaps indicating appropriate treatments and procedures have not been followed, would that come under the systemic failure or breach of duty of care that you were mentioning earlier?
I think there definitely would be an argument that it's a systematic pattern of conduct. Yeah, because and I think that's why they've put that in there, because it might not be that you've, you know, sustained some kind of catastrophic injury in one event. It could be that you're experiencing it over months. And then the dehydration and the malnutrition, I think that's why they added those to the rules. So they've kind of, they've passed the Act and it's in place, but they've expanded on that list in the rules. But I think psychological harm is a very interesting one. It's not listed in any of the lists in the Act or the rules. They don't mention it at all, which makes me think that they purposely are leaving that for the common law. But I don't know. Yeah. Yeah.
Okay, just looking at
that's a good question. Can you expand the differences between responsible government and non-government? Yes, so the responsible person duty only applies to non-government executives.
Okay.
Yeah.
So you've answered, I think, the question about were there any protections for clients who are self-funded. Self-funded in aged care facilities. I made a reference to part of that, I think, earlier, but
yeah.
Any further detail that can be provided?
Yeah, so it has to be funded aged care services. So it's in the provision of government-funded aged care services. So if they're not funded, then the reading of the Act suggests that you're not covered. Well, not that you're not covered, it's that your provider doesn't have the same obligations as when they're delivering funded aged care services. Yeah.
And I think someone's mentioned up here, Re Rebecca is replying to Cindy rather, sorry. My understanding based on this webinar is that provider provides the correct food, reasonable effort in terms of their responsibility, but it's up to the older person to eat what they want, and perhaps have the consequences of that. So it's an interesting challenge to
Yes.
find yourself on the right or wrong side of that argument.
Exactly. And that I think a question came through before by the registrants about that, like how to manage the risk and honoring that dignity of risk with upholding your duty to provide quality care and ensure the safety and well-being of that person.
Mm.
When do you override that? And it might be clearer in a hospital setting, but it is quite different in the aged care setting.
Yeah.
Yeah.
Yeah. And I think this is just the tip of the iceberg, really, in terms of how what people are finding in looking at the new Aged Care Act and engaging with it and understanding the responsibilities and
Yes.
and the opportunities for them to make a complaint.
Yes.
And Kim has just popped up a question. Does aged care justice ever consider alternative dispute resolution options such as mediation in appropriate matters, particularly where preserving relationships or resolving family decision-making conflict might prevent escalation?
Yeah,
It's
it's
a pretty
brilliant.
interesting angle, that
Really,
one.
yeah, brilliant question. I know that when we submitted a submission, it was the largest submission that we put together for the Aged Care Act in the lead up to the Aged Care Act, and I think that's just before they delayed it. And we had a section on that because we had the panel of lawyers, our panel of lawyers, put together their thoughts, and that was a major one. That there's no sort of facility offered in that space, apart. And when I say no facility, there are wonderful resources, but what's the process where there's a complaint that's made to the provider, and it could be that it's a dispute because of personalities, because of clashes, because of a family disputes. It's really complex, and especially when it's heightened because their loved one is really sick or really ailing, and everyone's got good intentions. And so a dispute resolution mechanism, which is embedded in aged care provision or the provision of care, would be great. I think it would de-escalate. So we put a recommendation for that into our submission. Yeah.
Sorry, go on.
And in terms of if like there are a lot of times where we receive complaints and they might not reach that legal threshold. And so it's important for us to know what kind of resources exist out there, like the dispute resolution resources, like I think it's Relationships Australia. So we do give people, let them know that these resources exist, so they can explore them. But we just think it would be wonderful if, and I'm sure some providers are amazing and they do provide information on these resources, but if it was embedded in some kind of process for dispute resolution, it would be great. And I think some contracts, it depends on the contract as well, will have a dispute resolution clause, some don't.
We had a lunch and learn prior to Christmas with EMAN, and they do elder mediation services across the country. And I noticed there's a comment in here from a person who is a mediator and conducts elder mediation.
Excellent.
It is a growing area, and
that's great. Should be in the Act. It wasn't included in the Act, but that's great that it's recognised. Yeah.
I think what we're seeing with elder abuse specialist services, for example, that the case management and mediation services are incredibly important and very effective.
Yes.
There's some barriers to get past in terms of, those interfamily disputes, and whether or not an older person may want to engage in that sort of mediation, in terms of shame and embarrassment and perhaps some very old family history and behaviours. But
Yes.
mediation seems to be a really important part of the picture in terms of being able to resolve issues and move forward.
Absolutely. And obviously, if not covered by that, does that also mean they're not SIRS reportable? What was that in relation to?
Not covered by the Act. Self-funded, I think.
Self-funded, yes.
Kerry, is
So
that right?
private pay, yes.
Yeah.
Yeah, so the Act makes it clear that duties don't apply unless the provider was delivering funded aged care services. So a reading of that is that if you're not delivering funded aged care services to that person, then that duty doesn't apply. Again, that's the reading of the Act. But it would be good to get it would be great actually to get direct clarification from the Aged Care Quality and Safety Commission. So I will write to them to see if we can get some definitive clarification on that, because that is the reading of the Act. That's how that's the consensus of the reading of the Act, but it would be great to get clarification on that from so I'm going to put that down as an action, and I can circulate what they advise. Because a lot of people are moving to private pay. Yeah.
So a comment from Karen from the ACT Human Rights Commission. Some of the adult safeguarding agencies will cover issues with privately funded providers as will health complaint commissions.
Yeah. And there's an argument there, that we've spoken about internally, that if you're not under a publicly funded aged care service, you might actually have more avenues, because now you're exposed to consumer law, your, health law, all of the instruments. And even though they exist alongside the Aged Care Act, because you're within that model, you're guided by that act and that instrument. But when you're private, there might be, you can then, it's consumer law, it's health law, it's all of those instruments that exist outside of that is definitely your avenue. Whereas when you're in government funded service, then it's a little bit more complex. It's a little bit more constrained. Can the aged care provider charge clients for travel for the support worker and they get to take the client for social support? I'm not sure about that one. I can look into it.
Okay, Janice, we're going to grab that and any of these other unanswered questions or things that are a little bit more nuanced to go through in this session. We'll grab those and ask Katrina and her team to help us with a response. Katrina, are you happy to share a link to your submission?
Absolutely. So we can share the submission that involves dispute resolution. And then there's a recent submission that we made as well. I don't know if anyone else did in the chat, but there was a submission about the aged care rules to the Senate Standing Committee. I think it was about a couple of weeks ago now. And that was our most recent one. So I can share that as well.
Okay, thank you.
Yeah. But yeah, mediation and dispute resolution, it's just so important, because a lot of the issues as well that come through to aged care justice, substitute decision making is a predominant factor in these issues, and people acting on behalf of others, thinking they're doing the right thing, but actually acting outside their authority. It's a very complicated area, the substitute decision making.
And in fact, Julian asks a question a little bit earlier about what options are there for people who have lost capacity whilst in care and don't have any enduring documents, either EPOA or Guardian, to provide legal instruction or any instruction actually to make a complaint or seek redress. There's no simple answer to that, really. If people
Yeah.
don't have, whether in care or at home,
Yeah.
without those enduring documents and written instructions, it's impossible, really. It makes it incredibly difficult.
Incredibly difficult. It does. And I know that, and this is more from a provider perspective, because in the application of restrictive practices, if someone doesn't have someone who can consent on their behalf, so they haven't put in place legal authority for an EPOA or a guardian or even a supporter, or they may not have family that can represent them, then the provider has to make an application to the tribunal for the tribunal to act as substitute decision maker. But that has been sort of initiated because of a provider need to apply care practice. It's not to necessarily advocate for the person like you're talking about.
Yeah, for the older person's rights, it's actually more the provider that is being covered, I suppose, to be putting it politely. Okay, sorry, just been a couple of comments that are rounded up, not in here, but from the questions that were asked the other day, that we asked to inform the presentation today. I think generally people have highlighted the need for culturally responsive care, safe dementia-related practices and effective communication among care teams. Whatever the version of culture and intersectionality might look like, I think it's a really important point to make. And I think, if I'm reading between the lines, and I'm no Aged Care Act expert by any means, but I think those of us who sit with providers and around the Act and responses to the Act, it's certainly something we need to keep on top of and keeping asking questions about. And so one person's asked, again, this is not directly in the comment questions, but respondents asked how older people, families and representatives can advocate more effectively under the new Act. Is there anything you'd like to add in response to that comment / question?
Yeah, there's a provision in the new Act, which is quite interesting because it's for supporters. So you don't have to be an EPOA, you don't have to be a guardian. Obviously, the person has to have decision-making capacity, but they can nominate you as a supporter. And that gives you the ability to make decisions about their care and their everyday care, because what you see is, especially from different state to territory, it changes. So substitute decision-making law is state-based and it changes depending where you are. And because the Act is a federal act, sometimes it produces gaps. And, then you say, okay, well, who can actually consent to this restrictive practice? And we found that anomaly in the Aged Care Act, where they had to bring in a interim hierarchy until the states brought in their own laws about substitute decision making for restrictive practices. And Victoria was the first to do it. But so what that means is there's that gap there, because you have all these legal instruments like EPOA, guardianship, medical decision maker, but they're very concrete in what decisions they allow you to make on behalf of someone. Whereas the supporter in the Act can make decisions about care, not make decisions, advocate for the person who has decision-making capacity for them to make their own decisions. And I think it's an important role, because it's not, we kind of view care as you have capacity, you lose it. But when you do have capacity, there's still a chance for exploitation. You're still vulnerable. You're ailing, you're getting older, your mind's not working as fast. Doesn't mean you've lost capacity. It means that you need someone to help you make decisions that you want to make. So I do think that that's an interesting part of the Act. It's called supporters. You can register a supporter. So I think that's a good way to support someone, but also just understanding that person, talking to that person, understanding their needs, understanding their day-to-day, what they really want. We have a lot of complaints that come through, and it's about the misuse of substitute decision-making authority. and sometimes you think, wow, this person really wants the best for their mum or dad, but they're actually breaking the law because
Yeah.
they're banning their brother who might have been, might have borrowed a bit too much money off mum and dad, but mum and dad don't have dementia. They still have decision-making capacity, and it's their choice to help this, help their son. And you think, okay, well, you don't actually have the authority to deny your brother to visit your parents. But it's complex. It's complex because then it comes down to that dignity of risk, and it's their
Yeah.
decision. And
And I think, Katrina, is something that we've talked a lot about internally. I mean, not just us, we're not the experts either in that, there's lots of people who have that space, but, capacity isn't a binary question. You do or you don't.
no,
It's so nuanced and diverse, and I think we all need to understand that quite a bit more as we continue to understand what our responsibility is to better support older people, and so forth. Look, I recognise we've gone a couple of minutes over time, but I'm sure you'll thank me help me thank Katrina for her presentation today. It's such a complex issue. You can see that with comments and questions, and all of the myriad of questions we had earlier prior to the session starting today. Really appreciate your contributions, and we'll try and gather as many answers as we can and share that with everybody.
that'd be brilliant.
Someone's already added a link to your submission in the chat, but we'll add that anyway into the collection of documents and slides. Thank you all for being with us this afternoon.
Thank you so much for the engagement. I just really, it's wonderful. It's wonderful. And it's just such it's such a complex area. Elder law is just increasingly more and more complex, but it's being recognized now as an area of law, and the law councils are all putting in funding for increased expertise in elder law. Yeah.
Can't happen soon enough. So look, thank you, everybody. We had a record number of, I think James might correct me, but over 670 people registered for this session today, all of whom will receive a link to the YouTube clip of this session, along with any of the packages of information that we've been talking about through the webinar. Lunch and Learns are held monthly, as I mentioned. Our next one is on the 12th of March, Building Connected Communities Where Older Adults Thrive. And it's a co-presentation between Relationships Australia National and Queensland offices. It would be remiss of me to not finish up without reminding you of the 2026 Australian Elder Abuse Conference, Stand Up, Speak Out. It's being held on the Gold Coast the 27th to the 29th of July. Early bird registrations close on the 28th of February, so please get in and grab your savings as quickly as you can. Hoping to launch the first release of the program tomorrow. So keep an eye on conference.eaaa.org.au. And if you're a member and like to present, just talk to James Thomas, membership at eaaa.org.au. And if you're not a member and you'd like to, please jump online and join us. Thank you so much again, Katrina, and for all of you who've joined us this afternoon. It's been a fantastic, if not complex, conversation, and we look forward to seeing you again in March. Thanks so much and have a great day.